Nisha, the PA over here at Dr. Emer's office, and today we are doing CO2 with Fractora. Now let me show you guys really quick some of my patients before photos. This is how he looked. He really had some problem areas around his mouth, a lot of breakouts, especially along the mouth area and then on his forehead some. So we were able to really take care of, improve his skin. Number one, we started him on Accutane. That really helped to take care of a lot of his active acne. Remember, if we're going to go ahead and treat acne, we want to get it under control first, because it's the acne that causes a lot of the scarring, hyperpigmentation. And so let's do that first, and then we can do lasers as well on top, right? So right now my patient is doing his Fractora. It's the microneedling with radio frequency. He's not really in any pain. You guys have heard me say this before, where the forehead is the spiciest, but in this case my patient had nerve blocks. I just got done giving him nerve blocks, so his face is pretty numb. He's still awake. He did still have his topical numbing. He's moving right now. So he's still awake right now, but the nerve blocks makes it a lot more comfortable to get Fractora done. And it's always open to any of my clients. If you want to get Fractora and maybe you have a very low pain tolerance, we can always do nerve blocks first, and that way you can be super comfortable. So in this case, forehead's not the spiciest. Now I'm going to have him turn a little bit more to your left. Perfect. I'm going to move to his lateral side.
Nisha, let's tell them how we cleared up his acne. What do we do?
Now we cleared up his acne, or cleared up in this photo from his initial photos, a combination of using Accutane but also lasers as well. This isn't his first time getting Fractora done. I've said it before, I'll say it again. Fractora is one of my favorite treatments to use for acne scarring or texture concerns, whether it's fine lines and wrinkles. Really combining Fractora with any of your laser treatments is a solid treatment plan. Now today we are combining our Fractora with CO2. Once again, remember that Fractora is microneedling with radio frequency. I'll show you guys, those are the needles, and on the end we're delivering radio frequency, the radio frequency energy, which is going to help to retexturize his scars. You can already tell from initially this photo here, his skin is a lot more smoother than it was. So no more acne outbreaks along the face, especially along the around the mouth area, on the forehead. Look how he looks now. I'll show you guys his face before I actually do treatment in this area. Look how much smoother the area is. Now we're going to do an ablative laser today, which is really going to help to further retexturize, resurface his skin. Keep him nice and smooth.
You guys, that's going to be our deep CO2 lasers. Someone said they can't wait for us to work all their magic on their acne scars. We have somewhat patients on here, it looks like. Someone's saying hi to you from earlier today. They were watching us do Fractora on our patient.
Hi!
Hey guys, our Fractora is safe for all skin types, correct, Nisha?
Yes, it's safe for all skin types. I can use it on my skin type as well. I'm a little bit darker, Fitzpatrick 6. I've used it on all of my patients, especially when their main concern is acne scarring, especially when they have textural concerns. This is really amazing to use.
Someone's asking for our RF power, guys. We're not going to tell you any settings we use. We purposely hide the screens in our videos. I'll tell you that.
Perfect. I'm going to have you look straight. Perfect.
Someone's asking, what is this technology? Nisha, can you tell them a little bit?
So this is Fractora. This is microneedling with radio frequency. I like to call it microneedling on steroids. Typically, if you're very new to microneedling, a lot of patients are more familiar with the typical microneedling that we do with PRP. Well, this is a little bit of a step above that. This actually is delivering radio frequency energy along with the microneedling, and that's going to give him a lot better results to really get his acne scars looking really minimal. So take a look at his before photos. You can see a lot more acne scarring is a lot more apparent in those photos. And now look on this part of his face. I haven't treated this area yet. Look how much smoother it is. Now, of course, we're going to get them smoother, so we're going to do an ablative laser today. We're going to continue doing Fractora. Remember, when it comes to taking care of your skin in general, but especially if you have texture concerns like acne, it is a process. You want to make sure you can doing your maintenance lasers to really take care of your skin. It's not really a one and done type of thing.
Someone said, does Dr. Emer decide about treatments for the patients or the PA? Who does the treatments?
Hey guys, it's Nisha the PA, okay? So you can have a consultation with Dr. Emer. You can also have one with myself or our treatment coordinators. Of course, I work along with Dr. Emer. So I'm always a forever student. So I'm always learning. So we're almost done.
What's the best treatment that you recommend for little capillary veins on the nose area?
So little capillary veins, we can do V-beam to that area, but we really got to take a look at it. We would love to have you guys in office. We can do a virtual consultation as well if you guys aren't close. We will come to you virtually.
Guys, if you're on the East Coast, we will be there November 12th to 16th. Be able to treat you guys on the East Coast. Someone's saying his skin is smooth because he's swollen, guys. He might be a little bit swollen from nerve blocks, but our patient has done Moxie lasers before. He's done microneedling, and he's also done a CO2 in the past and some Accutane.
Yes, this is not all from swelling, guys. This is consistent treatment. This is good skincare. You can't go from this to this with just swelling. This is Accutane. This is a combination of things that we've put together to really improve our patient's skin. He is a testimony to that. He's awake. He just is pretty relaxed right now because we've done nerve blocks, but he's awake. Say hi.
Wow.
All right, do upper lip, tuck your upper lip for me. I know it must be really hard, right? Like I can't pull that far.
So I said, I'm in the East Coast, New Jersey. Come see us, guys, November 12th to 16th. If you guys need a consultation with us for LA or New York, send us a DM with your full name, email, and phone number. We'll have our team reach out to you.
All right, guys, we're just done with our Fractora, the microneedling and radio frequency. We're going to move on to our CO2 lasers with Dr. Emer. This is Nisha the PA at Dr. Emer's office, and until next time, I'll see you guys then. Bye, guys. All right, I wanted to get your nose, but I'm going to do it off